This conference will now be recorded.
All right. Hi, everyone. My name is Bhavna. I'm a doctor working as a medical registrar in the NHS right now. What the purpose of this session is that we made this session especially for nurses because we feel that most of the content online is more focused on doctors. So with the help of a few very good nurses working in the NHS, we have made this session targeted towards nurses, specifically talking about OET writing. What we'll try and do in this session is I'm going to go through a sample solve letter. We're going to teach you a good method of solving letters and how we advise our students to solve letters. Um, then we'll go through a solved sample and see how we reach the answer that we got, and how we can apply our method in trying and solving letters in the future. And then we'll have a session which will be by Mr. Manoj Sharma, who's an English expert currently working at the Aligarh Muslim University, a very renowned Indian university. He's an OET expert, so he'll try and go through the tenses and basic grammatical mistakes which people make on the OET writing section. We'll try and go through tenses in particular in terms of grammar topics, but he'll just give us a few tips and tricks, especially dealing with OET writing and how to increase your score in OET writing by improving your language. So those will be the two things that we'll try and do through this session. We'll be accepting questions. So if anyone has any questions, they can type in the chat window. Um, but just make sure that your questions are related to OET writing itself so that we can apply all of your questions during the course of this lecture, which will be quite helpful for everyone. So make sure that you type in any questions that you have. We'll start the session now. I'll be doing the first part now, and then we'll have Mr. Manu join us and help us out in terms of grammar for the OET. All right. Um, so if you can see the screen and you can see the presentation on the screen, please type in yes, and then we'll begin our session. Can we just make sure that everybody's the camera can be on, but make sure that your mic isn't on, so that everybody gets to hear the presentation. So just make sure that's done, and then we'll begin the presentation shortly. We'll give us about 2 minutes to start. While people are waiting, in case of any questions, just type in on the chat window, and then we'll begin shortly. All right. So first of all, we'll just go through the basics of OET writing and what we recommend you to use as a method when you start writing your OET letter. So what I tell all of my students to do in the beginning is you don't read the whole task itself. So you'll get your case notes and you'll get the task which is at the bottom. What I tell my students to do is skip all the case notes and then go straight to your task when you begin your OET writing. So you read the task and then you understand what your audience is. So you read the task and you ask yourself 4 questions. You ask yourself, what is the purpose of the letter? Who is the audience for this letter? So who is the person that you're writing this letter to? Is this a GP? Is this another nurse? Is this a social worker? Is this a specialist, or is it a psychologist or a psychiatrist? So you need to know why are you writing this letter and who are you writing this letter to. Then you need to ask yourself, what does the audience need to know to do this job? So they'll give you a job to do. So they'll tell you that you're supposed to write a letter to a psychologist, and then you'll ask yourself, why am I writing this letter to a psychologist? Then they'll give you a job that this letter is for this lady who's been having a history of alcohol abuse. So now you know that I'm supposed to tell this psychologist a history of this patient's alcohol use, and they need to understand this patient's alcohol history, and they might need to know a little bit about their social background as well. The most important question, however, comes at the end, which is, what does your audience already know? So this gets a bit tricky, especially when you're dealing with GPs or people who already know your patient. You're not supposed to repeat information that they already know. It can also be that you're referring this patient who's already known to the social services, or they're already known to a district nurse, and you are a hospital nurse. So if you're a hospital nurse, um, you will know this patient only for the time that they're admitted in the hospital. But when this patient goes back to their regular district nurse, the district nurse is already going to know about this patient. So you don't really need to repeat all of the things again, especially with general practitioners. Let me just explain what a general practitioner is, because that's a concept that we struggle as, especially if we're working in a foreign country and we're moving to a Western system. So in the UK or in Australia, where the OET is based, everyone, when they're born, they get registered with a doctor. This doctor is called the general practitioner. Now, this doctor is going to deal with you from the day that you're born to the day that you die, or their practice. You'll have like a set of doctors, a part of the GP practice. They're going to deal with you from the day that you're born to the day that you die. So they're going to have all your medical records. They'll know all about your visits. They'll know every time you went to the hospital, every time you were referred to a specialist, and every time you had a major life event. So that's the role of a GP. So if you repeat past medical history in front of a GP, you're going to just waste their time. The purpose of OET writing is to fulfill your job in the shortest time possible. So just try and make sure that we understand that concept before you put your pencil to your paper. So just try and ask yourself these 4 questions before going on to the content. One thing that I tell my students to always do is, now that you've known what your audience is doing or what your audience wants, then you anticipate your case note. What anticipation of your case note means that in your mind, you try and guess. For example, I've read this task, and this was a lady that I'm referring to a district nurse, and she's been newly diagnosed with diabetes, and I'm referring this patient to a district nurse who's going to administer insulin to this patient. Or I'm referring this patient who's a known diabetic, and he's got a diabetic foot which needs daily dressings. So I'm referring this patient to a tissue viability nurse. Okay. So now, once you've read your task, try and capitulate in your mind as to what actually is needed, or what might actually be included in the case note that you definitely need to include. So that would be the history of diabetes. Guys, if there's a problem with the internet connection, please let me know, and we'll try and deal with the issues while we're at. Make sure that you don't miss any parts of the lecture. Just type in the chat window if you have any issues with your screen. Right, so going back to what we were discussing is, so you'll anticipate on your case notes that this might include something about this patient's diabetes history. This might include something about their medications. They might touch upon things like compliance. They might talk about social factors which might affect this patient's life, for example, alcohol use, drug use, or perhaps not taking their medications on time because of a stressful job. So you need to know all of these things and anticipate your case note before you start your letter. So always, when you get your 5 minutes to start, so you won't. So when you're doing your OET writing, you're going to get 5 minutes when you're just reading. You won't get to underline anything. You'll just get to read your task. So in your 5 minutes, you move on straight to your task, and then you just start reading what your task is. You know your audience, and then you go back to your case note. Right. Then what do we do about the case note? What I tell all of my students to do is, now that you've got your case note, you've read your task, then you go back to the actual body of your letter, and then you go through the letter, and then you underline the things that you think are important or do need to be included, and then you cross off. So you're allowed to write on the actual letter, so you can cross off the things which do not matter or which aren't to be included. So remember, on the OET writing, you're assessed on two things. You're assessed on your content, and you're assessed on your clarity. Content means that you include all of the important medical history for this patient, and clarity means that you exclude all of the things which aren't really important for this patient. So what I'll do, I'll try and make this session a little bit interactive. So you have your letter on the screen. What I want everyone to do is read your task and then tell me which are the things which aren't important on this letter and which you would cross off or you would not include when you write your letter. So the question that we do now is that you are to tell me what on the letter on the screen, what are the things which aren't important on this case note and what you would like to exclude from your letter. So everyone, please go to your chat window and you're going to type what isn't relevant on this letter. So that is the question. And then we'll give everyone about 2 minutes to answer, and then we'll discuss. So the question that we have for everyone is, on the letter that you see on the screen, what are the things which are irrelevant and which you would like to exclude? So Benita, if the letters are too small, you might want to open this on a laptop, but don't worry, I'll read out the letter and we'll go through these things again. So the writing task is that this patient has been admitted to your hospital. So you're a registered nurse working in a hospital. Was admitted in your hospital for a short time, and now they're getting discharged back to their GP, and you've got a case note which tells you the things which happened during this hospital admission, the plan that you made, and the discharge notification to the GP, and the discharge plan for the GP. So we've started getting answers. So Dr. Aditya Jadhav has said that he won't include information about living in own apartment and earnings. So that's right. When a patient is admitted to a hospital and they're going back to their GP, including things like past medical history, which isn't really relevant, um, is going to cut down your marks. So let's just try, and I'll try and solve the letter for you guys. So, like we discussed our method, you need to understand audience awareness. Nirma Rai has said that she won't include medical history. Benita Sunil has said she won't include past medical history and social history, so that's correct. Guys, please make sure that you turn your mic off, because it's interfering with the sound, so make sure that we turn the mic off. All right. So what we need to do is we just need to understand the task first. So what I'll do, I'll go back to the letter again and I'll read what the task was. So my task says, using the information as above, write a letter to GP Dr. Gerald Smith, informing him about this patient's condition and healthcare needs. Mention pertinent social status. Address your letter to Dr. Gerald Smith, GP, Fremont Surgery, London, W1. So, using my method of going to the task and then anticipating my case notes, I would then try and solve this letter. Now, I've become aware of my audience. I will ask myself, what is the purpose of this letter? So this is a discharge letter. So remember, on the OET writing, you can have either a discharge letter, a referral letter, or a transfer letter. When you read your task, you immediately identify that this is a discharge letter. So when you're talking about discharge letters, we need to mention the particular visit, and that would be the main point of your letter. So discharge letter means that this patient was with you for a short time and then they're going back to their regular doctor. Okay, so your purpose is that you identify what happened during this visit and you update the regular doctor regarding this visit and this visit only. So just remember that this was a discharge letter, and now I am aware that I'm going to concentrate on this visit only. I will exclude the history, which wasn't important, which lots of people identified that it was the present medical history that we needed to mention, and we needed to update the patient's health status. Past medical history wasn't really important. Then lots of people wrote that they would not include social history. Guys, please read the task again. If we go back to the task, there was a trick point here. So the task asked you, mention pertinent social needs. So this was actually a part of your task to include social needs. And there's a there were lots of points which were related to this patient's social needs. And this patient was to be referred to the CBT team as well. So even though this was your patient's regular GP, still you needed to mention important social history. So do read the task very, very carefully. So now you need to understand what does your audience need to know. So this GP needed to be updated about the hospital admission, and they needed to know about the patient's current needs, which were identified, or you found out about these needs during this hospital admission. And it was felt that this patient's social needs were very, very difficult to deal with, and that's why the GP needed to be reminded. So you need to understand what the purpose was. Then you ask yourself the fourth question: what does your audience already know? And that was everything prior to this admission. So we already know that this was a GP, and they already knew about this patient's past medical history. All right. So now the method that we use, if we've read the task, then we go back to what was important. We cut down our irrelevant history, and then we try and divide your case note into anticipated paragraphs. So I'll try and explain dividing the case note into anticipated paragraphs later, but now we'll highlight what was important and we'll cut out the irrelevant history. And that's what we've done here. So this is the method that I want everyone to try and use and see if it works for you. We've read the task, and now we highlighted each and everything which we think is very, very important for this patient. And then I just cut out the history that I didn't need. So now your case note has become smaller, and now you have a plan in your mind. All right, I'm going to include all of this information for my patient. All right. So what I did on this actual letter is I've highlighted, just remember guys, you need to know the salutation in front of your patient. Guys, please make sure that the mic is off. All right. So what we've done is we've highlighted this patient's salutation. So this was MS June Fortune. So they've given you a salutation for this patient. What salutation means is that some people they want them to be addressed by a certain certain salutation. So some women like to be addressed as Miss, some like Mrs, some would refer to themselves as MS. So in this case, you know that the patient wants to be addressed as MS. So I've highlighted that and made sure that I would use that in the body of my letter. Then I've highlighted the fact that this patient was diagnosed with thyrotoxicosis and new onset atrial fibrillation because that was important. I haven't really highlighted the medical history of hyperthyroidism since 9 years because that's something that the GP would already know. I haven't really highlighted the age and the marital status because I am not really sure whether I would include that or not, but I've definitely cut out the fact that the family history or the family details aren't specified. So I've cut that out because I know that's not important. Then I've also cut down the allergies because that's something the GP would already know. So I've cut it out. I've cut down the family history of coronary artery disease, that her father died from coronary artery disease as 89 years of age. So that wasn't really important. I've cut out the sister's history of eczema because that's not really relevant to the task at hand. And I've cut out her job. I've cut out own studio and income. Remember, our task did say that we're supposed to highlight the important social needs for this patient. If this was a normal discharge letter and they didn't tell me to do that specific thing, I would have probably cut out a lot of the social history. But because our task told us the GP needs to be reminded of these social needs because arrangements need to be made in the community for this patient, that's why I've highlighted all the pertinent social history. I've highlighted nursing management and progress because that is something which didn't happen in front of the GP. The GP was in his clinic, this patient was with you. So they need to definitely know about the management that you did and the discharge plan that you made, because that's all which is required for continuity of care. So let's just try and explain what continuity of care means. So when you make a discharge letter and you're working in a hospital as a nurse, this patient is now going to go back to their regular uh, clinician. We need to make sure that whatever happened in the hospital is passed on to this clinician, because now this clinician is going to be responsible for this patient. Your responsibility with this patient ended when you wrote this letter. Now you won't be able to get in contact with this patient. Therefore comes the concept of continuity of care. And that's why discharge letters are very, very important, because you're supposed to mention every single thing which happened in the hospital. If you miss something, then this patient's treatment is going to get affected. And that's what they're trying to judge on the OET writing, is whether you're a safe nurse, whether you're a nurse who, when comes to work in the UK, will she be doing her job well. So that's something that you can try and do when you start solving your letters. Now that I've cut out the things which weren't important and I've highlighted the things which were important, I will have a format organized in my mind. So all of us should know what the basic format of letters on the OET writing is. I've just made a very, very basic format which is displayed on the screen. You write down the recipient's name, you write down the address. This is something that you'll get from your task. Then you write the current date. Guys, remember, in the discharge letter, you can either, you should use the date this patient is discharged, which was specified on your case note. You can write that. But if you write the date of your exam, you won't get your marks cut for it. But what I advise all of my students to do is to make sure that this letter looks authentic. So you write the date this patient was discharged. Then you write regarding patient's name and date of birth. Now remember, in this letter, there was no date of birth given. So you can also write the age of the patient. You can write, so you'll use the salutation which was specified for this patient, which was MS, and the patient's name. And then you write AGED and then the age of the patient. Then you leave a line and then you write, dear doctor / Mr. / Miss. Remember the salutation which was given, and then you start writing your letter. Remember, sometimes you may not have a name for the patient, name for the audience, or name for the person that you're writing the letter to. You might have just district nurse. So what you'll do is you'll write dear district nurse. So just remember, they can try and trick you. Do not write just dear nurse. You're supposed to write the whole designation of the person then. So you'll write dear district nurse or dear tissue viability nurse. So you write the whole designation for the patient or for the audience. Now going back to the letter itself, because we had parts to the letter, now I'm going to organize my paragraphs. It's very, very important that your paragraphs flow like a story. So you actually get marks for it as to how your formatting is and whether your OET writing is organized into proper paragraphs and do the paragraphs make sense. Now in this letter itself, I would write my opening paragraph. So I know in my mind that I'm supposed to write the discharge details, the details of admission, and the need for follow-up in the opening paragraph. Okay, so I've made like a rough format for myself before I start writing. Then in the middle paragraphs, I know that I'm supposed to write the details of admission, the treatments done, and the new diagnosis for this patient. I've also written important social history in the middle paragraphs because that was a part of my task. So in my mind, I know that I'm going to make 2 paragraphs. In the first one, I'm going to talk about the details of admission, treatment, stunts, and diagnosis. And in the second middle paragraph, I'll write about the important social history. Then in the concluding paragraph, I'm going to reiterate, or I'm going to repeat the purpose of the letter again, and I will thank the doctor for their help because I'm a polite person and I have marks on the OET writing for this. So that's how, now starting from the task, going on to the case notes, I now have a format ready in my mind before I start actually writing my letter. So this is the solve letter. You can take a screenshot of this if you want. This is how I've answered this letter. So I've written the GP's name, then I've written the date, then I've written regarding this patient, then I've written Dear Dr. Smith. I've started my letter by being very, very polite. So I've said, thank you for seeing Miss Fortune. I am writing this letter to discharge. So I've written my purpose, Miss Fortune, back into your esteemed care. This pleasant lady would need ongoing management of both her healthcare as well as social needs. So guys, just remember that we've now reiterated our purpose and we've sounded very polite and we've written the purpose of the letter, the discharge letter, in the opening paragraph itself. So it's very good. Then we move on to our middle paragraph. So we had already planned that we're going to write about this admission and then I'm going to write about the social needs, but I'm going to split them into 2 paragraphs. So I've written that Miss Fortune was admitted to Queen's Hospital on this date with thyrotoxicosis on the background of known hyperthyroidism. So I know that this GP already knows about hyperthyroidism, but I've just made sure that they went back to the diagnosis of thyrotoxicosis and hyperthyroidism rather than telling the GP that this patient has hyperthyroidism, because that would just count as irrelevant because you're repeating something the GP already knows. Now I've written, she was further diagnosed with new onset atrial fibrillation. And then I've written about the drugs. And I've written, there have been concerns regarding her compliance to carbimazole. Then I've split my paragraph and now I'm talking about, I would also like to highlight this lady's social needs. So because I've started a new paragraph, I've made sure that the beginning of the paragraph tells you what this paragraph is going to be about. So I've told the GP, I would like to highlight this lady's social needs. So this is something that we can do, especially if you're talking about past medical history, or if, for example, if you have a lady that you're referring to a tissue viability nurse and they've got diabetes, then you can start the paragraph with, I would like to highlight this lady's diabetes history. So that's something that you can try and do. It's a very good method of splitting paragraphs. Then you write, unfortunately, Miss Fortune has a very stressful job. So that's an excellent connector to use because we're talking about social history and we're talking about social history which is stressful for this patient. I've written, unfortunately, comma, Miss Fortune has a very stressful job. Then I've used another connector. So OET loves connectors. The more connectors you write on your letter, the more your score can increase. So then I've written, subsequently, comma, she usually feels too tired after work and is unable to have any outside interest. So that's a good connector to use. Then I've written, her non-compliance to medications may be following her divorce. So that's how I've linked the divorce to non-compliance to medication. It was also noted that she has had an increase in alcohol use. So see how we've split up our paragraphs into medical history and social history. Then I made another paragraph of talking about discharge plan, but the paragraph starts with highlighting what this paragraph is going to talk about. So it says she is now being discharged today with a plan to continue her anti-thyroid medications. And now I'm going to talk about what the discharge plan was. So this was our middle paragraphs, and they have been organized by type. So they've been organized by a background history, history of admission, social needs, and it is going back to your medication history. In the last line, I've just done my conclusion, which is very short. It's just, I would like to again thank you for your help in the continued care for this lady. If you have any questions, please do not hesitate to contact me. Remember, guys, we can use this line, so you can copy this line when you're writing discharge letters, that I would again like to thank you for your help in the continued care for this lady. So you can actually copy this line and you can use it in your own letters, especially when you're writing discharge letters. You can also use this for referral letters. For example, if you're referring a patient to a cardiologist, or you're referring a patient to a cardiac rehab center, or you're referring this patient to a tissue viability nurse, you can again use this, that I would like to thank you for your help in the continued care for this lady. Anita has asked, how many paragraphs can we write in total, including introduction? Anita, it actually depends on you, how comfortable you are in organizing your letter. So in this case, I use 3 middle paragraphs. You do need to have a clear introduction paragraph, a body, and a concluding paragraph, but your middle paragraphs, they can be split depending upon what your content is like. So sometimes you can have a patient with multiple visits and you would want to mention all of the visits. So what people do is that they split each of the visits into different paragraphs. So that's something that you can do. So it's not really specific as to how many paragraphs you can write. Sahila Paul Raj has asked, what about transfer letter? We can start like this. I am writing to transfer Mr. X. So you can do that, but you would write, I am writing to transfer. So the Mr. should be capital, Mr. X to your care. So it would follow, transfer is followed by a to. So make sure that we do that as well. Aditya has asked, is it okay to provide subject reference by mentioning just name and age, or we need to mention condition, member, suffering too? So Aditya, you can provide by just mentioning the name and age. So you can start your letter by, thank you for seeing Miss Fortune, a 46-year-old lady who is a patient of thyrotoxicosis. So you can actually do that. You can mention the patient's condition, and that can be done, but just starting like this should be fine as well. Sheila has asked, can we start this letter as a refer back into your care? So I would not advise using the term refer, because this is actually a discharge letter. Referral means that a patient is your patient, but you want a specialist opinion. So I would rather say that you write discharge letter rather than refer back. Guys, make sure that your mic is off. because we're getting a lot of interference. All right. So just keep asking questions um, on the chat window. Now, what I'll do is we'll keep answering your questions, and I'll take questions at the end as well. But we'll have Mr. Manoj Sharma now come in and help us with grammar things. I think it's very, very important that we cover grammar today, because we've seen that lots of nurses struggle with grammar topics on the OET writing, and they often fail the OET writing because of bad grammar. So Mr. Manoj has made a very, very good presentation talking about the grammar topics um, in OET writing and common mistakes that we make in grammar, especially with regards to OET writing. We'll try and make grammar a bit easier for you today and applicable to your OET writing. So use the tips very, very carefully and make sure we listen in very carefully. Grab a pen and paper if you have, and then we'll he'll be asking you lots of questions, so try and grab a pen and paper and try and solve the questions while we're at it. And I'm still accepting questions, but now I'm going to answer the questions in the end. But just keep typing in the chat window if you have any questions, and I'll try and answer as many as I can before we end. So I'm just going to bring in Mr. Manoj online now. While we're waiting for him, just keep typing in all your questions. All right, we're just waiting for Mr. Manoj to join us. While we're at it, I'll just keep answering questions. Dr. Aditya Jadhav has asked, ma'am, can you please provide good connectors to use? What I'll do, Dr. Aditya, is before we end, we'll share a PDF. I've made a list of connectors which the OET tells us to use and tells us to avoid. So I'll send a PDF across to everyone. Atul has asked how to write conclusion and introduction with some difference. Like I did on this, you are supposed to reiterate your purpose when you're finishing up. Like what I did on this, I first thanked them and then I talked about a discharge, but in the end, I talked about continued care. So that's how you can try and split the introduction and conclusion. PC has asked 46 years old or 46-year-old. So this is actually given on the official OET website. So 46 years old is the best way to do it. Gagandeep Singh has asked, can we start from I am writing? Yes, Gagandeep, you can use I am writing, but make sure that you sound polite. So you can write, I am writing this letter to discharge misfortune back into your esteemed care or back into your kind care. And then just make sure that you thank them. So you can write, I'm writing, so you start your letter by, I am writing to discharge misfortune back into your esteemed care. Thank you for your help in the management of this lady. So make sure that we write a thanks, because remember on the OET writing, you have marks, especially for politeness. So we'll try and say thank you as much as we can during this letter. So we're still waiting for Mr. Manoj to join us. Guys, if you have any questions, I'm happy to accept questions while we're waiting. Anita has asked, Madam, can you please tell me that we can mark the important things in the question paper? So that should be fine. You can mark the important things if you like. But remember, you can't mark before you start, before the 5 minutes end. So in the 5 minutes that you're given just to read the letter, you cannot use your pen or pick up your pencil. But once the 5 minutes are over, you can start writing it down.
Hello. Am I audible?
Guys, please make sure that your mic is mute. So if you have any questions, I'm happy to accept them.
Yeah, ma'am. I am having one question. Is it okay? Can I ask?
Atul, if you can please type in your question because there's a lot of interference from sound. So guys, I'm happy to accept questions. You can keep typing in. Nanma Ann has asked, can you please tell me different types or styles of introduction? So Nanma, just remember, you can have lots of types of introduction. I'll try and type it out in this window. So if you want to copy it and apply it in your future letters, you can. So you can do something like, I am writing this letter in order to transfer this patient back to your care. Or I am writing this letter to refer this patient to your care, or thank you for seeing misfortune. Full stop. I am writing this letter to refer this patient back to you. Nirma has. Guys, we'll just take a break for about a minute while I bring Mr. Manoj on. But if you have any questions, you can keep typing. All right. Nirma has asked, could you please teach us about writing, which has too many visits and many complaints? For instance, subjective and objective. This kind of question always comes on the OET exam. So Nirma, you're actually right. This does come quite a lot when you have multiple visits. You need to first read your task. You need to understand the purpose of the task, because sometimes you can have visits which aren't really important for the task at hand. For example, you might have a patient who's being referred to a psychologist, and the visits might be talking about things like this patient coming in with a respiratory tract infection, or coming in with things which aren't really psychological. So you'll have to cut down those visits first, okay? Um, Include only things which are important to the person that you're writing to. For example, if you're writing to a psychologist, you would include things like subjective complaints of feeling sad, uh, tearful, feeling upset, losing a job, and objective complaints of low mood. So make sure that you understand your task. This does happen quite a lot. We've had past tests where we had a patient who's actually surgical, and they were talking about psychological history, and the people who included that, they got their marks cut down. So you can keep typing in if you have any questions, but I think we've got Mr. Manoj online now. So I'll just make him the presenter now, but keep typing in your questions, and then we'll try and answer them at the end as well. All right, we've got Mr. Manoj online now. Mr. Manoj, can you hear me?
Yes, I can hear you very well, Dr. Bhavna. Am I audible to you?
All right, so let me just introduce Mr. Manoj again. So Mr. Manoj Sharma is actually an excellent teacher of OET, and he specializes in the grammar aspects and the language aspects of OET. He'll try and explain a few topics today. So make sure that you have a pen and paper, and we're going to be going through common mistakes as well. So make sure that we note down this while we're dealing with it. We'll ask lots of questions during the course of this interaction. So we'll be typing in, we'll be displaying the questions on the screen, and then you can just type in your answers, and then we'll see who does the best today. So I think Atul and Jonah Jane still have questions. We'll keep answering them while Mr. Manoj gets his screen online. Jonah Jain has asked, ma'am, I asked, where does the word count begin from? So the word count would actually just be the body of the letter. So they won't really count the address and the starting, the GP's name and things. Abdul has asked, how do we write introduction and conclusion of a referral letter, which shows some differences in syntax? So Atul, what we can do is we'll try and discuss a few solved examples at the end, and I'll just give you a few points as to what you can copy and apply to each letter depending upon the type of letter that you have. PC has asked, shall we mention patient's name in every paragraph? That's not really necessary, but you can just mention, rather than using the patient, you can just use Miss Smith. All right, now we'll have Mr. Manoj take over.
Hello, everyone. Now, first of all, I want to know that am I audible clear to all of you? Okay. So Anita has replied yes, and Shauna Jane is also replying yes. Okay, fine. So, doctors and nurses are preparing for OET. First of all, I want to pay my sincere regards to all of you that you are fighting this hard in this crisis of COVID-19. The world has known as to what the true strength of doctors and nurses is. So, good afternoon once again, and my sincere regards to all of you. I would now begin my session. We are here at TCU Academy, and we prepare for OET examination test. Now, OET examination test is one test, but it comprises of 4 sections that you all know. Which one are those? The reading, listening, speaking, and writing. Although all 4 of the sections are very significant for this examination, and each one has a specific role to determine as to whether you qualify the exam or not. But still, getting a little bit partial towards writing, I would like to say that some students often get a bit lesser confident in this section of this test, that is writing. Some students tend to lose their confidence, their ability to write well when the examination is actually taking place. So now what we have to do? The first thing and the only thing that we have to stay focused. And this focus is not only for writing, but this focus is for each and every section of OET exam. May it be reading, may it be listening, may it be speaking, or may it be writing, your focus determines whether you would qualify or not. Now, what is this focus? I would like to narrate a very small story to acknowledge the strength of focus. Once upon a time, there used to be a teacher long time ago, and this teacher would teach his students the art of archery, that is aiming arrows with the help of a bow. So one day what happened, that the teacher was teaching his students the art of archery for many days. So he thought of taking a test of those students. So one day he took all of those students to a garden. In the garden was a tree, and on the tree was a very little small bird. Now what happened is that the teacher asked his students one by one as to what were they able to see on the tree. The first student said, "Sir, I can see the tree, the leaves, the fruits, and the bird as well." The second student replied that, "Sir, I can see the flowers, the birds, the leaves, the branches, the tree, the bird, and everything, of course." The third student also replied the same, that, "Sir, I can also see the tree, I can also see the bird, I can see the branches, the leaves, the fruits, the flowers, the blossoming birds, and the hills behind the tree." So all the students replied almost the same answers, ranging a bit differently. But then there was a student. When he was asked as to what he was seeing, he replied that, "Sir, I can only see the bird." The teacher asked once again that, "Be thoughtful. I give you another chance. Tell me, what do you see?" The student said, "Sir, I can see only the bird. The teacher once again gave him a chance and asked that this is your last chance. Tell me as to what you can see. Finally, the student gave the same answer. Sir, I can only see the bird. And that student was the one who qualified the exam. Now, wow, why did this student qualify the exam? Because he was focused. He knew where I am, what I am here for, and he replied accordingly. He was there to shoot an arrow with his bow. He had no relationship with the hills, the mountains, the branches, the leaves, the fruits, and all of other things. He saw only the bird. So this is what is required, your focus. Let me now share my screen with all of you. So now here my screen is getting shared with all of you. And I would like to present a very small Microsoft PowerPoint presentation with all of you so that we could easily understand as to what this writing section of OET is all about. Okay, fine. Ladies and gentlemen, suppose a case note is given to you. What do you usually do? I would like to recreate the full ambience with all of you. There is an examination hall. There is a teacher standing in front of you. There are other students also. You are seated on your desk, your benches. The question paper has been given to you. Now what do you actually do? Once the question paper is given to you and you see the case note of the writing section, you read it, you go through it. The first thing, take your time. Take your time to build up your confidence. Take your time to stay focused. Take your time to read the case note properly. Secondly, understand the situation. Understand the ambience, the surrounding. Understand your patient. Understand his or her illness. Understand the entire ambience. Be into it. Just get practically into it. Once your mind gets into a situation, you would be able to reflect your writing in a better manner. Thirdly, you analyze your role, who you are. What have you done for the patient? Are you a nurse? Are you an anesthetist? I'm sorry, since I'm not a doctor, so I will not be able to pronounce these words in a better manner as you people do. Forgive me for that. So what you have to do is that you have to understand your role. Fourth, understand your reader. Understand as to who is going to read your draft. Is he or she is a dentist? Is he or she a psychiatrist? Is he or she a general practitioner, a nurse, a cardiologist? Understand his situation. Try to understand and fathom the level of his knowledge. Next, you have to understand the urgency of the case. Get to know as to how significant this case is, how significant the urgency of the case is. And finally, just underline or point out the necessary information. Sometimes in the case notes, not everything given is necessary. You have to recognize that information which is relevant and which is irrelevant. You would have been seeing a lot of videos on YouTube and on other platforms also. Everybody goes on telling you the same thing. But has it ever imbibed into your brain? Do you understand the significance of this sentence, relevant and irrelevant information? From now on, you have to. Now, of course, I mean, this is not a new thing to be told, but since the formality says so, I have to say that use the name and the addresses given to you in the case note. Do not get diverted due to your lack of confidence that you accidentally use your own name or some of your relatives' name. Do not do so. Use the name and the address given in the case note. Do not use chunks from the case notes. That is, just do not copy what is given in the case note into your writing. Of course, you know it pretty well. There's no need to tell you all this, but still. The third thing, do not include everything. The examiner knows how to play with you. He will intentionally give you some information which is not necessary. You have to understand the psychology of the man behind your question paper. Just try to understand that he is trying to mislead you. He or she is trying to misguide you. He or she intentionally wants you to commit certain mistakes that you don't have to do. So recognize the necessary and unnecessary information. Just underline with the help of a pencil, a crayon, or something other thing. Okay, fine. Very important. Very importantly, what you have to do is that you use your own words. Use your own words. Now, there are certain words like heart, like diabetes, like blood pressure, like wheelchair, that have no other substitutes. You cannot replace these words that are given in the case notes. But there are certain words that have substitutes which you could use in your writing. Try to recognize those words, try to increase your vocabulary, try to know the substitute of certain words that are given in the case notes. So you have to use your own words as far as possible. Now, there is a thing that one of my teachers taught me when I was in standard 5. It had been a very long time. Coder, but it is still drilled into my brain, and I always, whenever I write something, I follow this rule. This is a word, coder. It signifies 5 things. 5 things. Now, what are these? The first is compose. You compose your idea. You compose what you are going to write in your brain first. Secondly, organize your idea. You have to know as to what should come in the first paraphrasing, in the second paraphrasing, in the third, and so on. Just organize in your brain whatever you are going to write. The thirdly, draft your ideas. Now you start drafting your ideas. Start bringing them on the paper. The fourth is, if necessary, you can edit your ideas. If you feel that somewhere you have gone wrong, edit your ideas, and finally revise your final draft. I hope if you follow this strategy, the strategy of coder, it would be very rare that you fail in any sort of writing. So now, what is the purpose of our writing? If a case note is given to us, what is our purpose? Have we ever pondered upon this fact? Why are we writing? What is the goal of our writing? That you have known when you analyzed your role and the role of your reader. That is the person you are going to write to. Now, this purpose has certain intricacies that your purpose must be there in the first paragraph. In the first paragraph, you should be very brief and straightforward as to why you are writing. The second thing, that your purpose should be immediately identifiable. Your reader should quickly know as to why you have written to him or her. This is very necessary. We would take a sample example for this. This I have taken from a letter, and the case notes have not been presented because this was not my motive. I just wanted you to know as to what the purpose is all about. Now, this page that is on your screen is the purpose of your writing. Let's see. This purpose is divided into 2 parts. the first paragraph and the second paragraph. Now look. The first paragraph says, it is to a doctor to whom somebody has wrote. He or she, that is the person who is writing, is saying that thank you, doctor, for seeing Mr. Jeff, a patient at this practice. Now, if you look at the screen, you would notice that I have written practice in bold. Why is it so? This practice has been written in bold to let you know that in this practice, that is in front of your screen, P-R-A-C-T-I-C-E has used, because it is a noun. If we write P-R-A-C-T-I-S-E, that is a verb. So you should know that what the same the word that we hear in the same manner, that is practice and practice, they differ when we write them. So here this practice has incorporated C, not S. So I would read the line for you. The writer is saying, thank you, doctor, for seeing Mr. Jeff, a patient at this practice. Mr. Jeff presented today complaining of sore eyes and worsening vision. I am concerned. Now see what the writer has said, that thank you, doctor, for seeing Mr. Jeff, a patient at this practice. He presented today complaining of sore eyes and worsening vision. I am concerned that he has been experiencing symptoms consistent with diabetes type 2. Now see, what the writer has said is that he has explained the current situation, the purpose of his writing in the first part of this purpose. That is the first paraphrase, that is the first paragraph. That thank you, doctor, for seeing Mr. Jeff, a patient at this practice, who presented today complaining of sore eyes and worsening vision. I am concerned that he has been experiencing symptoms consistent with type 2 diabetes. Now you would be wondering that I have also highlighted this consistent with. Why? This is to let you know that with the word consistent, with is used. If I had used persistent, I would have used to. Persistent to, relatable to, type 2 diabetes. With consistent, I have used with. So this is the current situation that happened today at the clinic, that Mr. Jeff complained of sore eyes and worsening vision, and I, who wrote the letter, is concerned about his health. So the straightforward motive of the letter has been written in the first paragraph. The second paragraph would expand the purpose of the writing. Always remember, the second paragraph always expands your purpose of writing. Now, how do we expand the purpose of a writing? Look at the second paragraph. Mr. Jeff has had several infections in the past. Last month, he presented with low blood pressure, fatigue, dizziness. As a result, I organized blood tests. The tests showed elevated readings in random glucose and fasting glucose. Now you see, what has been done in the second paragraph is that the situation just prior to the present situation has been detailed over here. For example, if Mr. Jeff came to me today, the entire situation has been written in the first paragraph. In the second paragraph, I have wrote as to what I did with my patient prior to today. What examinations I performed over Mr. Jeff, what I suggested him, and other things. Now, I have highlighted has had. I have also highlighted presented. I have highlighted tests showed readings. Why? Okay, coming to tests showed, I would say that whenever we perform a test of some individual, what does that test show to us? The test shows us the readings. So here the statement has been written as that the tests showed elevated readings in random glucose. If somebody writes that the tests showed elevated random glucose, that's wrong, because the test does not show you any glucose. The test will give you readings of the glucose. Again, last month, Mr. Jeff presented. That is, this is simple past tense. He presented last month with low blood pressure. Mr. Jeff has had. This is present perfect tense. Present perfect tense. Mr. Jeff has had several infections. Coming further, the second thing that the examiner, the evaluator of your letter is concerned about is the content of your letter. Your letter must only contain the key information. Your letter must only contain as to what is relevant. Now, how do we manage this word relevant or relevance? It depends upon the reader of your letter. The reader of your letter would, his profession, the one who is reading your letter, his knowledge, his qualifications, and the area of his specialization would let you know as to what is relevant in the case study and what is irrelevant. For example, if I send some of my patient to a cardiologist, I would be giving him the information regarding his blood pressures in the recent past. I would be giving him his readings of blood glucose in the recent past. I would not let the cardiologist know as to what the status of his eyes is, what major surgeries he had undergone in his eyes in the past. Of course, in some cases we can, but for a cardiologist, what has happened to the eyes of a patient is of lesser relevance. What is of more relevance is the blood glucose, the blood pressure, the cholesterol level of the patient. The content of your letter also signifies as to what the reader of your letter must know. No necessary information should be missing from your letter. You can be into the shoes of the reader of the letter. You can ask yourself, as to had I been the reader, what information would I have wanted in amongst the information given in these case notes. So again, a very regular thing that I want to tell you, that your letter must be concise. It is being said in the instructions of the exam that write only 180 to 200 words. So your letter must be concise. Now, how would your letter be concise? Your letter would only be concise when you develop a habit of underlining the relevant information given in the case notes. You take a highlighter with you, you take a pencil with you, and you just mark, either you mark or you highlight or you underline the relevant information, the necessary information. As soon as you read the letter, you come to know as to who you are going to write. Step your feet into the shoes of the reader of the letter, and then you would be immediately, you get to know as to what is relevant amongst these case notes. So this is how you would be able to make your letter concise and brief. And you should be very clear. Now, this clarity is much emphasized in the first and the second paragraph of the letter. So be very clear whenever you write a letter. Be very clear when you define the purpose of a letter. Again, we have the genre and the style of writing. That the genre and style of writing. We'll discuss this when we take an actual letter. I would let you know as to what your genre and style of writing should be and how your letter should look like. Do not use much of abbreviations. Avoid using abbreviations. You can develop, you must know as to where to use apostrophes and where not. This is how you develop your own genre of writing. each individual has a different genre and style of writing. In the same way as we have our thumb impressions, the style of writing of any individual differs from the other individuals. Now, how the layout should your letter should be? How should the letter look like? What should be its form be? Whenever we say layout of a letter, we always emphasize upon the perfection of paraphrasing the case notes. Now, this paraphrasing is, you can maintain and develop your paragraphs by numbering also, by the level of their significance. For example, the first paragraph of the letter is the most significant part of the letter. The second paragraph expands the first paragraph. The third paragraph, in the third paragraph, you can mention the socio-economic, the leisures, the hobbies of your patient, and other activities that your patient is indulged into. In the fourth paragraph, you can recommend a plan. You can conclude, you can ask your reader, you can ask the doctor to whom you're writing for help. You can request. And lastly, you put salutations, proper salutations, and you come to a conclusion and you end your letter. This is called the layout of the letter. In the body of the letter. For example, the same case we took previously about Mr. Jeff. This is the third paragraph that defines Mr. Jeff. Now, in this third paragraph, the hobbies, the physical, socio-economic conditions of Mr. Jeff has been described. Only those ones which are of relevant to the doctor. Now, since this letter has been written to an endocrinologist, so the doctors who deal with diabetes and blood sugar levels. So here, the information relevant to the doctor has been written. For example, Mr. Jeff is overweight. Being overweight is directly related with the diseases concerning with blood glucose. The body mass index of Mr. Jeff has also been mentioned, so that the doctor comes to know as to what the physical condition of the patient has been in the past and is in the present also. The hobbies of the patient has been described. Suppose your patient is fond of playing badminton. That is a very good sign. You can let the doctor, you can let the reader of your letter know as to what the hobbies of your patient are. Here, the hobbies of Mr. Jeff has been stated as sedentary, that he does not do much of workout. He has been seeing a physiotherapist for an exercise program and the management of his knees. However, he has been unsuccessful and not been able to reduce his weight significantly. Now, you would notice here that I have highlighted unsuccessful and not been able to. Why so? There is a reason behind this. These both phrases, that is unsuccessful and not been able to, are grammatically and logically correct here. But unsuccessful is a bit demotivating word. If we use such a word with our patients, we would not actually be encouraging or boosting the spirit of our patient, or we are trying to use some pessimistic words in our letter. What our approach should be, that we use optimistic words. We should develop a habit of using good, morally good, optimistic, nice, polite words. So we would not use unsuccessful here. We would rather use not been able to. So, however, he has not been able to reduce his weight significantly. In the second paragraph of this section, we have mentioned that Mr. Jeff has no known allergies and he contracted infectious mononucleosis in 2006. So this was the relevant information that I picked up from there. Coming to the next part. Now, this is the conclusion of the letter. Here you see that the writer is stating that I would be most grateful if you could assess Mr. Jeff's condition to confirm the preliminary diagnosis and, if appropriate, recommend a management plan. Now, just see the beauty of this paragraph. Whomsoever has written this paragraph, he or she has written it very beautifully. I truly appreciate. Why am I appreciating so significantly this paragraph of this writing? Here, the word would and could have been used. Now, what are these words, would and could? Of course, would is the past form of will and could is the past form of can. But here, these have not been used in relevance to the tenses. Here, would has been used to make a request to the doctor. The writer of the letter is actually making a request, is asking, requesting in a polite manner. So he or she, that is the writer, is stating that I would be most grateful if you could assess Mr. Jeff's condition. Now see here the word assess. There is another word access, ACCESS. Do not mistakenly ever use that word. You have to use assess, that is to analyze, observe, come and conclude to a situation, a condition of a patient. Furthermore, the writer of the letter is saying that to confirm the preliminary diagnosis. Now, the writer of the letter is not saying that whatever diagnosis I made was correct or I came to a conclusion. The writer of the letter is requesting the doctor to whom the writer has written that please confirm my preliminary diagnosis. How beautiful this is to be written as. And if appropriate, recommend a management plan. So this is such a beautiful, nice, polite, dignified request that the writer has made. These are the sections of the writing where some students fetch more marks and they qualify the ALS or the OET examinations. Lastly, yours sincerely, doctor. Now there are some entry cases in these two lines, yours sincerely and doctor also, which we will be discussing very soon in the coming slides. Now, whenever we write in a language. Every language has some rules, and those rules are the use of prepositions, the use of conjunctions, the use of tenses. There are certain people who get confused in the usage of tenses, or some people are very good at using tenses. They themselves sometimes do not know as to what form of a tense have they used in the writing. Suppose if somebody immediately asks you, whatever you just spoke, can you let me know as to what tense was that? And you're not able to tell him or her, how embarrassing that situation would be. So speaking, writing, knowing things is fine, is okay, but to know what you know is also very important. So language forms the very significant part of writing. Now, what is this language all about? This language is about tenses, connectors, subject-verb agreement, and punctuations. Tenses we would be taking in detail in the coming section of this program. The second part is connectors. Now, we all know what connectors are. I would define a few connectors like however, moreover, nevertheless, along with, besides. Now, OET has certain rules in which the analyzers or the rule makers of this OET examination like or want the students taking the exam to use the connectors. The third is the subject-verb agreement. What is this? What is this subject-verb agreement? The statement says that the subject must agree with the verb and the verb must agree with the subject. I will let you know as to what the subject-verb agreement is. Suppose I say that I like to play hockey. Now, here the subject is I, and the verb is play. Play or like? Like. The verb here is like. So suppose I say that I like to play hockey. So here, with I, since I is a plural, it is considered as a plural. Although I is just one individual, that is me, but in English, the rules of English, I, we, you are categorized as the plural subjects. I would recapitulate the terms I, we, you, they. Again, I, we, you, they. These are plural. He, she, it. These are singular. He, she, it are singular. Once again, to drill it into your brains, I, we, you, they. These are plural. He, she, it are singular. Now with plural, singular verb must go. That is, with a plural subject, singular verb must go. With a singular subject, plural verb must go. Again, I repeat, with a plural subject, singular verb must go. With a singular subject, plural verb must go. Now, since I like to play hockey, I is plural, so like is used. Suppose I say, you you play tennis. Why haven't I used you plays tennis? No, you play tennis, because you is plural, so singular verb has to go. Now I say he play hockey. Is it right or wrong? He play hockey. Of course, this is wrong, because he is singular, so the verb must be plural. So he plays hockey. I hope this is clear to you. Lastly, punctuations. There are some punctuation marks like full stop, comma, semicolon, exclamation mark, question mark. Out of these, you only have to use comma and full stop majorly, and minorly you can use semicolon marks, but in letter writing, you never have to use an exclamation mark or a question mark. Fine. Coming to the tenses, as I told you that tenses we would discuss in detail. The first tense is the present tense. All of us know the tenses. There are three tenses: present, past, and future. All of us know. Do we know their intricacies? No. We know the tenses. We know a person. Do we know what is there in his heart? No. We know a tense. But do we know the intricacies of these tense? Let me know. Now, this present tense is of four types. Simple. Now, how would we recognize that a tense is simple? If in a sentence there is first form of the verb, it is a simple tense. For example, sun rises in the east. Sun rises in the east. Sun is singular. There is only one sun that is to this earth. Sun is singular, so rises has been used. Rise has not been used. Since sun is singular, we have used rises. Sun rises in the east. Now, rises is the first form of verb. What is the second form? Rose. The third form is risen. The sun rose. The sun has risen. These are the three forms of the verb. So here in this sentence, sun rises in the east, the first form of the verb has been used. So this is a simple present tense. So whenever in any sentence you only see the subject and the first form of the verb, it is simple present tense. Just remember V1. Second, present perfect tense. How would we know as to whether a sentence is a simple present tense or a simple perfect tense or some other type of a tense. If you see has, have plus the third form of the verb, it is a present perfect tense. For example, I have done my work. I have done my work. Have plus the third form of the verb. I have done my work. I'm sorry, there has been a mistake over here. It's actually basically the second form. Nevertheless, let us revise few more sentences till then. Okay, fine, we are back. There was some sorry for the inconvenience caused. We were at the present tense and we have discussed the simple present tense. We are discussing the present perfect tense. Whenever you see has, have, and the third form of the verb, that is the present perfect tense. For example, they have accomplished the task. Have accomplished. Have plus the third form of the verb. They have accomplished the verb. The next tense is the present tense. Whenever you see ing, it is present continuous tense. For example, I am taking a lecture. I am taking a lecture. Ing. I am taking a lecture and this lecture is currently going on. This is present continuous tense. And the final form of present tense, the present perfect continuous. It is a combination of the present tense along with perfect and continuous, that is has, have plus been plus ing. For example, they have been doing their work since morning. I repeat, they have been doing their work since morning. Have been ing. They have been doing. Have been doing. That is present perfect continuous. Again, coming similarly to the past tense, we have its other forms, the simple past tense. Now, whenever you see the second form of the verb in any sentence, that is simple past tense. For example, I did my work. I did my work. Now, did is the second form of do. Do, did, done. I did my work. Did is the second form of do, so it is recognizable as the past simple tense. Next, the past perfect tense. We often get confused in past perfect tense. So there is a trick to recognize as to which statement is in its past perfect. Whenever you see had and the third form of the verb, it is past perfect tense. I would take an example. They had done their work. They had done their work. Had done. Had done. Had plus third form of do. Had plus the third form of do. They had done their work. Had done, you saw had done, and clearly it is recognizable as the past perfect tense. The next tense, past continuous. Now, how do we recognize if a sentence is in its past continuous? Was, were plus ing. I was doing my work. I was doing my work. I was playing badminton. Was plus ing. You see was plus ing, it is past continuous. And when we combine perfect and continuous, that is had, been, ing, that is the past perfect continuous tense. I take an example. They had been doing their work since morning. Had been plus ing. Coming to the future tense, this is the simplest of all types of tenses. The most complex tense is the past perfect tense. We often get confused in it. But if we would take several examples and the questions that would follow this lecture, we would be able to clear our concepts in tenses. Similarly, the simple future tense, I will do my work. It shall rain tomorrow. It will rain tomorrow. Will, shall. The perfect, will have, shall have. They will have done their work by now. The third, future continuous. They will be doing their work. Will be ing. They will be doing their work. And the last, if you combine perfect and continuous, then becomes the future perfect continuous tense. They will have been doing their work. This is the simplest of all cases. It is very easy to understand this. The only difficult one is the past tense and its several varieties. Now, ladies and gentlemen, I request you to open your chat windows, and I would be presenting a few questions in front of you, and kindly give me the answers of these questions. I will let you know as to how many of you have been able to solve these questions correctly. Okay, so the sentence is, she is teaching her students, and your options are, these are your options. Kindly write in the chat window as to what your answer should be. She is teaching her students. Kindly chat, just write your answers in the window. So Shauna Jane replies present continuous tense. Others, Sheila, present continuous tense. Very nice, very nice. This is what the answer is. This is the present continuous tense. She is teaching her students. This activity is going on continuously in the present, is going on. So she is teaching her students. This is present continuous tense. Others are not responding. Why so? Why is so in responding? The first, option 1, Pinky, first option, very nice, Vita, shabash. Sahila, option 1, Nirma Rai, the first option, very nice. Now I come to the second question. We have been waiting for them. We have been waiting for them. What is your answer? Come on. Now see, this activity is still going on. We have been waiting for them. This activity is still going on. We have been waiting for them. Come on, guys, come up with answers. See, this answer, this question, we have been waiting for them. This activity is going on still, but it had started in the past. Just listen to me. We have been waiting for them. This is an activity which is currently going on. But did this activity started just now? No, it started some time ago. So the answer is present perfect tense. It's not C. It's not C, it's present perfect tense. It's present perfect tense. It's present perfect tense, ladies and gentlemen. The answer to this question, we have been waiting for them, is present perfect tense. It's not present continuous. Should I come up with the third question? He eats with his left hand. He eats with his left hand. And your options are, these are what your options are. Come on, come up with answers. Ladies and gentlemen, doctors, come on. Shaban, simple present, very nice, very nice. Emma, very nice, good, doing good. Gagandeep, the first, very nice. It is a simple. Shauna, Nirma, Sahila, Pinky, all of you are doing extremely well. I'm very proud of all of you. The option 1, he eats with his left hand. This is option 1, the simple present tense. Similarly, sun rises in the east. He eats with his left hand. I do my work. These all are simple present tenses. The fourth question, ladies and gentlemen, we have learned our lessons. We have learned our lessons. And your options are, we have learned our lessons. This is something that has just happened and completed. No, not past perfect. No. Nirma, you are wrong, beta. Ponder over it once again. Option 2, yes, Gagandeep. Sahila, Malvi, Atul, all of you doing very nice. This is present perfect tense. Have. There is not had. We haven't used had here. Had we used had, it would have been past perfect. But since here have has been used, so this is a present perfect tense. Am I clear to all of you? If it is so, then kindly write yes in the chat window. Am I clear to you? Do you have any doubts? Okay, okay. Fine. Okay, MJ, do you have any confusion over here? MJ, do you have any confusion over here? Very nice, Atul. Very nice. MJ, I want to know from you. Do you have any confusion, any sort of a confusion? Maybe he doesn't have any confusion, or maybe he has a lot of confusions. With this notion, let me come to my next question. He has had his breakfast. A bit complex sentence. I would give you certain time for this. And these are what your options are. He has had his breakfast. Go on, ladies and gentlemen. Reply with your answers. Those of you who are replying past perfect, I want all of you to know that past perfect is recognized by had. Had, not has or have. Whenever you see has or have, it is present. Whenever you see had, that is past. Reply your answers once again. Ponder over it. He has had his breakfast. This is present. No, no, Shauna. This is present perfect tense. No, Shauna. This is present perfect tense. Do you have any doubt? Yes, MJ. Present perfect. Yes, Pinky, very nice. Present perfect. He has had his breakfast. This means he recently has finished his breakfast. He has had his breakfast. He's done with his breakfast. He's through with his breakfast. These are other forms of using the same sentence. Another question. The chief guest addressed the gathering. The chief guest addressed the gathering. Come up with your answers, ladies and gentlemen. The chief guest addressed the gathering. Do you see has, have, had here? First reply to me. Do you see has, had, have here? No, of course, we do not see has, have, had here. Then what do we see? What do we see then? We saw addressed, the second form or the third form of the verb. To address is to relate. So the chief guest addressed the gathering. This is simple past tense. This is simple past tense. Shona, you are not getting things clearly. Again, the answer is wrong. We haven't seen has, had, or have here. We have seen addressed, the third or the second form of the verb. So this is past simple tense. Yes, Sahila. Yes, Anita. Yes, Pinky. That's B, simple past tense. Let's come up with another question. They had been walking. Had plus been plus ing. Now see, look at the hints over here. Had been walking. Had. What is had? Past perfect. Continuous. Continuous ing. The options are
past perfect continuous.
yes, yes. Very nice. Very nice. It's past perfect continuous. Why? Why is it past perfect continuous? Because the first thing we saw in this sentence was had. Then we saw been. Then we saw ing. Whenever we see had, it is past tense. Whenever we see been, ing, that is something going on continuously. So this is past perfect continuous. Very nice, Gagandeep. Very nice, Emma. Very nice, Nirma. No, Anita, it's not necessary to mention time here. Of course, you can use that they had been walking since morning, but that is an unnecessary part of the sentence. Here it was not needed. But of course, you can complete. This is a hidden sentence. There is one wonderful thing of English that I would not be telling you today. I would let you know about it in the next session of ours. A very wonderful thing of English. If I forget telling you, do ask me or do give me a hint that, sir, that day you told us that you had in your brain some very wonderful thing about English. Please do tell about it up. No, Sahila, my time is all yours. You people are so supportive during this time of COVID-19. Whatever I'm doing is very negligent. Okay, now the next question, question number 8. Question number 8. They will have learnt their lessons. They will have learnt their lessons. And now the options are, and come up with your answers, guys. They will have learned their lessons. Will is future. Will have learned. This is future Perfect. Emma, you are right. Sahila, you are right. Pinky, beta, you are wrong over here. Ponder over it once again and let me know as to what your answer is. Pinky, I want correct answer from you. You have been doing extremely well in the last questions. I want a very correct answer from you this time. They will have learned their lessons. This means that the thing has been done. It's finished. And somebody is just guessing in his or her brain that by now they will have learned their lesson. It's gone. Yes, Pinky, see. Do you understand why is it so? Will and learned. Learned is the second or the third form of learn. And along with that, will has been used. So this is future perfect tense. Now I present one more question in front of you, but I will not give you options. You write me the name of the tense. Go on. Let me test you. They will be having fun. No options here. Okay, so Pinky says future continuous. Sahila has also replied future continuous. Nirma, future perfect continuous. Has this thing happened? Is it done? They will be having fun. Is it done? Nirma, I'm asking you. Nirma, you reply to me that they will be having fun. Have they ended having fun? Is it done? No. Somebody is pondering in his or her brain that they will be having fun. So this is future continuous tense. Future continuous tense. Yes, Anita. Yes, Samuel, Nirma, Pinky, Nirma, future continuous. Yes. Another question. Another question over here. We are waiting for them. And your options are. This is a very, very easy question. We are waiting for them. And your answer is. And your answer is, guys, we are waiting for them. I'm waiting for your answers. Come on. Yes, present continuous. Very nice, Nirma. Very well done. This is present continuous tense. Another question. Let's be quick. Yes, Shana, it's B. No, not. No, yeah, B. Present continuous. Nirma, Malby, that's B. I didn't sleep well. I didn't sleep well. Do you see has, have, had here? Do you see has, have, had here? No, we don't. Then what are we seeing? What are we seeing then? The second form of do. We are seeing the second form of do. Did. Simple past. Yes, Sahila. Yes, Pinky. Very nice. This is simple past tense. Simple past tense. No perfect. No perfect. Simple past tense. Emma, simple past tense. Very nice. Anita, simple past tense. Very nice. Doing good. Nirma, simple past tense. Very nice, Vita. Very well done. And these were options out of which you have opted for simple past tense. Let's come to the 12th question. She works at a factory. Be quick at giving me answers. This is a very, very simple tense. Sun rises in the east. She works at a factory. What is it? What is it? Come on. Simple present. Yes, Pinky. Yes, Sahila. Simple present. Yes. Very nice. Very nice. Very nice. Another question. Gagandeep, where are you? Have you left? I am not able to see your answers. Yes, Pauline. This is simple present. Very nice. Another question. He had sought the permission of his boss. Do you see had here? Had plus second form of verb. He had sought. What is it? What is it?
It's in past perfect.
Very nice. Past perfect. Very nice. Whomsoever replied, very nice. Past perfect. Perfect. Why? Because we saw had here. Very nice. Shauna Jane, very nice. Anita, very nice. Gagandeep, very nice. C. Go on replying, Gagandeep. You were doing very nice in the prior questions. Why you became so slow and invisible all of a sudden? This is your other question, question number 14. She had been running for hours. Do you see had here? Of course, we see had here. Do you see been? Yes. Do you see ing? Yes. And so the answer is no. Perfect continuous. Which perfect continuous, Pinky? Gagandeep, very nice. Sahila Paul, very nice. Pinky, reply me properly. Yes, past perfect continuous. Very nice. Don't be sorry. You're doing extremely well. Don't be sorry. Nobody should be sorry. All of you are doing extremely well, beyond my expectations. So these were your options, and this is past perfect continuous. And now the last question. Yes, Anita, it was right. Pauline, it was right. The last question, I will not give you options. Just reply fast. Come on. We are learning our lessons. Very simple tense. We are learning our lessons. We are learning our lessons. Pinky replied correctly. Nirma, it's not simple continuous, it's present continuous. You just spelt a bit wrong. You knew the answer anyways. Atul, present continuous, very nice. Gagandeep, very good, present continuous. Sheila Samuel, present continuous, very nice. So this is present continuous. And here we finish our exercise. All of you did extremely well. All of you did extremely well. I appreciate this. Now let's come to the last section of our lecture. Okay, ladies and gentlemen, let's come to the another section of our a lecture. Now, I'll show you a case note. Okay, I'll show you a case note. Please be very focused here. Do not divert your focuses. Once you divert your focus, you lose everything. Be the disciple who saw only the bird. So here, see only the case note. Just look at the case note that is and appear onto your screens. Just go on And let us get to what this case note is all about. It's getting a bit slower. Okay. Okay, fine. So I have eased it out for you. Here you can see the entire case note on your screen. Here you can see your entire your case. Are you able to see this case note? Kindly reply me with some yes, so that I would proceed further. Shona, you're unable to see. Sahila, you can see. Yes. Pinky, you can see. Shona, are you able to see now? Shona, are you able to see? Reply to me with a yes, so that I could proceed. Shona Jane. Oh, you're using your phone. Can't you just expand this? I know it would be a bit inconvenient for you, but please cope up, because this is something very essential that we are going to take. So fine, this is the case note. Just look at it. The patient details have been given. The name of the patient is Miss June Fortune. She's divorced. She's 46 years of age. She does not have a family. The date of admission in the Queen Hospital was 14 June 2015, and the date of discharge is 19 June 2015. Now, the diagnosis of Miss Fortune shows that she has thyrotoxicosis with atrial fibrillation that has recently developed. The medical history shows that she has hyperthyroidism since, for the last 9 years. She has no known kind of allergies. She does not have any sort of allergies. This is the medication she has been recommended. The medical history of her father has also been given over here. Now you have to see as to what is necessary and what isn't. The family background has also been given. She works as a tech secretary. She lives in her own studio apartment. She has no relatives and close friends, as mentioned in the first part of the case notes also, and she usually gets very stressed and tired after work. After divorce, she has not been taking her medications properly, continuously. She does not comply with her recommendations. Now this is the last part. The discharge plan, as you can see over here, the discharge plan monitor medication compliance in community, monitor alcohol intake, option to refer to drug and alcohol liaison, encourage establishment of social activities, prepare a letter to CBT therapy team in community. Now, what is your task? You have to read this very properly. Using the provided information as above, write a letter to her general physician, Dr. Gerald Smith, informing him about his patient's condition. Here you come to know as to what the gender of Dr. Gerald Smith is. He is a male. In your answer, expand the relevant notes and so on. So this was your case note. Just reread it once again so that I would come to the sample answer and would let you know as to how a proper letter is being written. Whenever you are ready, just let me know so that we could proceed to the sample answer so that you could know as to how a proper draft is composed and what sort of a draft would fetch you the maximum of the marks. Whenever you are ready, just let me know. Kindly read the letter properly and let me know whenever you are finished. The time given is 5 minutes. I have given you more time. Develop a habit of focusing yourselves. Pauline is ready. Pauline, just mark out somewhere as to what is the necessary information relevant to Dr. Gerald. Had you been Dr. Gerald, what information would you have wanted in your letter? Just mark out. Okay, Nirma is also done. Pauline is also done. Gagandeep, Shona, Anita. Take your time. I'm not hurrying things. Haste makes waste. You take your time. Sahila has also been done. Those who have done, just go on with the necessary information. Or if you have a text, something to write, a piece of a paper near to you, just jot down some significant details. That would be very nice. Practicing in this manner is most of the times very helpful. Atul is also done. If you have a piece of a paper somewhere near to you, lying somewhere near to you, just jot down some important information so that it could be much easier for us to elaborate the lecture further on. Anita is done. Gagandeep is done. Atul is done. Very nice, ladies and gentlemen. I would just have some few more dones and then we'd start a letter. So we have had enough of time. Let's come to as to what our sample letter looks like. Here I would again let you know some significant details. The patient's name is Miss June for June. Do not use Mrs. because she has been a divorcee. So we use MS. Putting a dot after MS is your choice. It's not necessary that you put a dot after MS. She works as a tech secretary. She had some ailments in the past, which have significantly been let known in the case notes. And now I would let you know as to what our answer looks like. So fine, let's see as to what a perfect draft looks like. You must remember that in the initial of our lecture, we discussed the strategy of coder, that is composing, organizing, drafting, editing, and revising your ideas to form a better draft, a better letter. Now this is what our letter looks like. This is the answer that looks like. Now I would explain things to you very slowly, one by one, taking one paragraph after another. Here, just see the body of the letter. Just see the body of the letter. This is the body of the letter here. This is the first part, or you could say this is the head of your letter. Dr. Gerald Smith, general practitioner, the name, the profession, the field of excellence of Dr. Gerald Smith. In the second line, he's a general practitioner. His address later on, Fremont Surgery, London, W1. Later on, as you can see, we put the date. Which date? Which date do we put? The current date. The day we saw our patient last. So Miss Fortune came to us on 19th June 2015, the latest, the most recent. And that is when we are discharging her. So that is the date that you could see here, 19th of June 2015. After this would come reference. Whom are you referring to? Miss June Fortune, aged 46 years. Now there is something. In some of the case notes, you would be given the date of birth. If you are given the date of birth, you write RE semicolon Miss June Fortune, and in the next line DOB colon the date on which the patient has born. Here the age of Miss June Fortune was given to us, not her date of birth. The age was given, so we have written Miss June Fortune, aged 46 years. Don't say it years. It's years. And before years, we use A. We do not use N. For ears, the organs we have for hearing, we use N ear. But for years, YEARS, we use A year. An ear. Do you get it? Atul, management of. We manage things. Management for could also have been used, but here management of. We are managing something. The discharge date, Sahila, the discharge date has been given. That is, we discharge a patient on the date when we last see him or her. So that is the discharge date. Now, the fourth part, dear Dr. Smith. Here, just note down some very important things. We have used Dr. Gerald Smith, general practitioner, Fremont Surgery, London W1, comma nowhere. We haven't used a comma anywhere here. Then we used the date, 19th June 2015. Again, we haven't used a comma over here. Thirdly, we have referred Miss June Fortune, who's aged 46 years, full stop. The reference has finished. We haven't used a comma, we have used a full stop. These are very, very minor things that you should know. Very few students know these things, and that is where they are not able to crack the examination. These are the very, very important things, the punctuation marks, the commas and the full stops and the colons. Now you see, until now, comma, full stop and colon all have arrived in the initial section of the letter. All the three punctuation marks have arrived. And don't you think that the person who is analyzing your letter, the person who is checking your letter would be able to focus upon these punctuation marks? Of course, he or she would. So be very, very focused upon the usage of punctuation marks. We proceed further. At the first paragraph. Now I told you that the first paragraph is where you would be able to fetch the maximum of the marks. Your first paragraph defines the purpose. Why are you writing? What is the purpose? What is your goal of writing? And your purpose must be very clear, concise, brief, and up to the mark. It must be relevant to the reader of the letter. It is a very well-known saying that the first impression lasts forever. The first impression lasts forever. So these are the first impressions, the body of the letter that you're writing, the initial phases of your letter. This is where you would be able to fetch the maximum of the marks. So in the first paragraph, we have written, thank you for seeing Miss Fortune, full stop. I am writing this letter to discharge Miss Fortune back into your just excuse me for a while. Miss Fortune back into your esteemed care. Now see how beautiful a word has been used, esteemed care. We could have written Miss Fortune back into your care, but no, we have to oblige our reader. We have to admire the level of his or her knowledge. So we are writing that I am writing this letter to discharge Miss Fortune back into your esteemed care. Now let us look at the tenses. Thank you for seeing Miss Fortune. I am writing this letter. I am writing. Which tense is it? I am writing this letter. Which tense is this? Future simple. I'm sorry, future continuous. Sorry. What has happened to me? Oh my God, my mind is boggled. I am writing present continuous. Something is going on in the present. I am writing this letter to discharge Miss Fortune back into your esteemed care. This pleasant lady. Now we have highlighted a good point, a nicer perspective of a patient. This pleasant lady would need ongoing management of both her healthcare as well as social needs. Here we have straightforward mentioned as to what the reader has to do. The reader has to manage her health as well as her social needs also. So in the first paragraph, straightforward, very clearly, concisely, we have let the reader of the letter know as to what this letter has been written for and what the reader of this letter has to do. Now in the second paragraph is always an extension to the first paragraph. Miss Fortune was admitted to Queen Hospital on the 14th June 2015. Was admitted. Here we do not see any has, have, or had. We see admitted. So this is past simple tense. She was further diagnosed with new onset atrial fibrillation. She was diagnosed. Which tense is this? She was diagnosed. This is past simple. Past simple, of course. She is on regular carbimazole. Which tense is this? She is on regular. Something is going on. This is present continuous. She is on regular carbimazole, propranolol, and diazepam as required. This is she is on regular carbimazole. Let me know as to which tense is this. She is on regular carbimazole, propranolol, and diazepam as required. Future simple, past simple, present simple, or present continuous?
Present continuous.
Which tense is this? She is on regular carbimazole.
Present continuous.
Somebody replies present continuous. The other version of this sentence could have been she is going on with regular carbimazole, propranolol, and diazepam as required. Now, the next sentence. There have been concerns regarding her compliance to carbimazole. Fine. Let us take the next paragraph. I would also like to highlight this lady's social needs. I would like to. This is a polite version. Polite, something politeness, something dignified has been used. I would also like to highlight. Here, would has nothing to do with the past tense of will. Here, would has been incorporated to show your politeness. Furthermore, the letter proceeds as, unfortunately, Miss Fortune has a very stressful job. Miss Fortune has a very stressful job. Which tense is this? Miss Fortune has a very stressful job. Simple present. Simple present. Subsequently, she usually feels too tired after work. She usually feels too tired after work. Which tense? Simple present. And is unable to have any outside interests. Again, simple present tense. She has no relatives. Simple present tense. Her non-compliance to medications may be following her divorce. Now, this is somebody is making a guess that it could be so. It could be so. It was also noted that she has had an increase in alcohol use recently. Now, this information was hinted in the case note. It was also noted. Which do you see has, had, or have? No, we see noted. So this is past simple tense. The fourth part, she is now being discharged today. She is now being discharged today with a plan to continue her anti-thyroid medications in the community. She is now being discharged today. Which tense? Is plus ing. Is plus ing. Present continuous. Present continuous. She is being discharged today. She is to be referred to cognitive behavioral therapy. She is to be referred to cognitive behavioral therapy in the community. She would need her alcohol intake monitored. Now here, the writer is suggesting what can be done, but the writer is not directly ordering the reader. He or she is making a request that I request to you. And here the word request has not been used. Then which words have been used to reflect a request? Would, could.
Would, could.
Fine. Yes, exactly. Would, could. See, in the last, it is being said, I would again like to thank you. How polite the writer is. The writer is thanking again and again. The writer is so positive that the writer used words like esteemed, esteemed care, pleasant lady, thank you, encouragement. These are positive verbs. Everybody likes to read and listen to these words. If you have any questions, please do not hesitate to contact me. If you have any questions, present simple tense, please do not hesitate to contact me. And then yours sincerely, very importantly, yours sincerely. Now you could see here that whenever we say that Jacob's book, how do we write? J-A-C-O-B apostrophe S, Jacob's book. Yours. Here in yours, apostrophe has S has not been used. Now this is something you should pay focus upon, that in the word yours, apostrophe S has not been used, and after sincerely a comma has been put, and then in capital nurse has been written, and this is how the letter has been ended. And this is some sort of a letter that an examiner would like to see, that an examiner would like his students to write. This is the type of the letter which would be able to fetch somebody the maximum of the marks. I hope you are able to clarify some of your confusions in this session. Although one session is never that much enough to clarify concepts in just 1 or 2 hours of class, we would be having few more sessions, similar sessions on tenses, and we would see the intricacies. And in the next session, of course, I would be discussing with you something that I told you, that there is a very wonderful thing in English that is maybe some of you would not be knowing. We will be discussing in the next classes. I wish you all the very best for your preparations. Now here I would like to conclude my session. I would request our organizer if they want to conclude in some other manner. I am done from my side. I'm through. Thank you very much for being with me. Thank you very much for being with me. I promise to have more enlightening and encouraging sessions in days to come. Here I leave more. Thank you very much.
Thank you so much, Mr. Manoj. You've helped out a lot. I think lots of grammar mistakes that students make have been worked on this lecture, but we'll keep on continuing. We'll try and do sessions like this in the future, where we'll try and cover a little bit of the content aspect and try to emphasize a little bit on the grammar side. We'll keep doing this in the future. We will be uploading this lecture onto YouTube, so you can watch this lecture again on YouTube, and you can keep an eye out for future sessions. We'll try and do some sessions next week. Just keep an eye on your WhatsApp to receive notifications of when it's done. If you have any questions, you can email teacheracademy@gmail.com. And we can also email you in case we are planning to do future lessons. Today we try to keep it only for nurses, but what we'll try and do is we try and group doctors and nurses again the next time, and then we'll try and solve the common mistakes which students make. But that's it. That's the end of the session today. Thank you guys for joining, and you've helped out a lot by participating. So it's always good when you have an audience which participates. Just keep practicing, see whatever mistakes you made today, and try and work on the mistakes on future sessions. Good luck.
Thank you so much.
Thanks a lot, ma'am. It was a good session. It was very useful for us.